Hi everyone, I'm Dr. Karam, board-certified facial plastic surgeon and founder of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very interesting and important topic, and that is, when do you know you're ready to have laser treatments? We're going to talk about 5 indications when you know you're ready to have a laser. I'm going to talk about the conditions and the laser that pairs along with them. I'm also going to talk to you about how to avoid complications associated with lasers. I'm also going to talk to you about things that lasers don't treat, common misconceptions that people have that think that lasers are good for, that they're actually not, and you end up wasting a lot of time and money. And then finally, I'm going to give you my honest opinion about what the secret to good skin is. And you don't want to miss that, trust me. It comes way before anything you do with laser treatments. All right, guys, so without further ado, let's dive in. So the first indication, one of the most common things that lasers are really good for is the treatment of brown spots. Now, what are brown spots? Brown spots are accumulation of melanin that originates from the cells deep within the dermis called melanocytes. After years and years of exposure to sun, finally at some point in your life, they're gonna start to stop repressing the production of melanin and instead start producing melanin. And when those melanin particles start to move up into the dermis, they form clusters, and those clusters basically become pigmentation. So brown spots are a cluster of melanin that form from melanocytes. So here's the thing, lasers all have particular targets, meaning that every specific laser has a very specific target that it addresses. Not all lasers are the same, and not all lasers address the same thing. So when you have pigmentations in the way of brown pigmentations, you want a laser that addresses and targets the brown pigmentation or the melanin molecule. And so what happens is, in that particular category, you have IPL and BBL. Those are probably the 2 most common and best type of treatments. Now, IPL it stands for intense pulse light. BBL stands for broadband light. So the BBL is a trade name for broadband light that originates from the company Cyton, which makes a very popular laser that addresses brown pigment. IPL is a more generic term, intense pulse light, and that is probably what you are more accustomed to seeing. Both are excellent. We in our practice happen to have the BBL because we like the Cyton machine, and I'll talk briefly about the differences between them, but suffice to say that the intense pulse light treatments are designed for targeting the wavelengths associated with brown pigmentation. So that's one of the best things that are used. Now, how do you use IPL? And I'm just going to use the term IPL from here on out instead of differentiating between IPL and BBL. Just know that I'm talking about both. IPLs are used in a series, and this is very important. When you go get an IPL, you never want to just get one IPL. That is a huge mistake. You don't want to get 2 IPLs. Not going to take care of it. And the reason is because the different depths of the pigment that are coming up from the dermis, you're not going to be able to get all of them all at one time because the laser only penetrates a certain depth. So suffice it to say, you want 3 to 5 treatments if you decide to go down the IPL route. Don't go anything less because you're just going to be wasting your money on it because you're not going to see the full-blown results. Now, you will see results even after 1 treatment or 2 treatments, but to get the full results, the full capacity of these lasers, you want to definitely go for 3 to 5 treatments. So note to self, brown pigment, IPL, 3 to 5 treatments. Next category, red pigmentation. Again, as we age, what ends up happening is the capillaries under our skin become fragile, they become broken, they become a little bit more prolific. Also, you start to see red discoloration. Some people are more susceptible than others, but it's also a consequence of sun exposure and sun damage. So, red pigmentation also has, guess what? Its own particular wavelength. The wavelengths that are associated with red pigment are targeting hemoglobin. And what ends up happening there is, again, you have a particular set of lasers that are associated and designed for this. The most popular is the pulse dye laser. Fantastic laser, very commonly used in a lot of different practices. It directly goes after the pigmentations that have red in them because of the hemoglobin from the blood cells. Now, BBL also has the ability to cross into that particular wavelength, and that's also a laser that's commonly used, especially for more or less mild discoloration. You can definitely use the Cyton BBL for that as well. So to summarize, you have red pigmentation hyperpigmentation, source being broken capillaries, and the treatments associated are going to be pulse dye laser, or in some cases the BBL, and I think some IPLs also can cross into that wavelength if you use the right filters associated with it. But this is a question you definitely want to ask your laser provider. Third condition is dullness. So dullness is basically a result of the upper layer of the skin called the stratum corneum. What ends up happening there is the stratum corneum starts to develop layer after layer after layer of dead skin cells. Think about it like an onion, right? You've got all those dead layers, and the onion on the outside looks very dull until you start peeling it down and you get to that glistening bright layer. Well, the dullness is coming from dead layers of skin causing the stratum corneum, which sits on top of the epidermis, to become thicker. And as a result, it doesn't reflect light, and as a result of that, it ends up looking dull. And remember, the most important quality of youth is that luminosity, that brightness that comes from skin that reflects light. So with dullness, the treatment is going to be removal of all the dead cells. So in a way, exfoliation, but a little bit more deliberately and a little bit more significantly, you're going to do it with resurfacing. So when you're talking about resurfacing and removing dullness, and also remember, dullness also leads to roughness too. So if you touch your skin and it has a rough quality to it and it's a dull quality to it, then you're going to want to be thinking about resurfacing lasers. And this is super important because I think a lot of people try to bypass this and try doing different things because they don't want to go through the downtime of resurfacing lasers. But guys, it is absolutely necessary. If you want to get that dead stuff off your skin, you want to use a full field resurfacing laser. Now, what are categories of this? Basically, this comes down to CO2 and erbium YAG. Now, the problem with CO2 is it creates a lot of thermal damage. So as a result of that, it creates a lot of redness and a lot of swelling into the skin, and the downtime becomes very hard for people to handle. Sometimes it can be greater than even 2 weeks to a month, and sometimes even prolonged redness beyond that. My personal favorite in this category is the erbium YAG laser. It's just a different wavelength. The target of CO2 and erbium is water. And guess what's packed in the skin is water. So as a result, the second it touches the surface of the skin, boom, it's starting to evaporate that water. And as a result of the evaporation, it's resurfacing and removing all that skin. That's how the laser works in those cases. Erbium YAG has the advantage that it's a cooler laser. It has less non-specific thermal damage, so there's less redness, less swelling, less downtime. That's why we choose to have that particular laser in our practice. The Cyton, which is the machine that we use, gives us the opportunity to use what's called a nano peel, a micro peel, and a deep resurfacing called a contour TRL. So depending on how deep we want to go, we'll use either three of those modalities in terms of successions of depth. But for just basic resurfacing, you can do a nano peel or micro peel level, which is a very, call it 10 to 30, 40 microns of depth, which is not too deep, and it's going to remove all those dull layers off the skin. And yes, you're going to go through recovery. Yes, you're going to have to use some ointment and deal with that, but if you do, you're going to be rewarded on the other end with a very bright skin palette, which is so important. But don't try using IPL for this kind of condition for dullness, because guess what? IPL doesn't remove any skin. And this is why this is so important, is for you to understand and navigate yourself through this. Now, a quick side note, you can do a modification here where you do a fractionated version of these lasers, meaning that only a portion of the skin gets resurfaced, but that means that you need to have 2 to 3 treatments. So if you choose to do something like profractional, halo, or Fraxel, those are all fractionated lasers. You're going to do them and you're going to have less downtime, which is all great, but you're going to have to make sure that your plan is to do them 2 or 3 times so that you can eventually cover the majority of the skin. Otherwise, you're not going to get a full level of correction there. So number 4, vertical lines. This is the whole reason why I got into the laser game in the first place, because I was frustrated when I would do these surgical rejuvenations, lifting the face and doing all this beautiful work, and then people had these deep vertical lines, we call them smoker lines, around the mouth. And a lot of times the patients aren't even smokers, but they have these lines. And the reason why those form is a combination of overall the skin starts to thin and loses elasticity. The skin of the lip actually gets a little longer, you lose volume. So every time you purse your mouth and you're speaking and talking or drinking from a straw, that motion ends up causing the skin to break in a vertical direction. And eventually, like any time when you're using your muscles to move move your skin over and over again, think about the 11s and the forehead lines. When you do that, the skin will break and cause a vertical line in the lip. And when that happens, you could try fillers, you could try some of these things, but guess what? They're rarely going to get rid of them in a way that it's going to be meaningful and ideal without overfilling that region or making that area look unusual. So fillers have a place in that area, but not a very substantial place. You have to use it very gingerly there. But laser resurfacing, you can go through and literally take down layer after layer and layer and layer until you get to the base of that wrinkle or that line, and as a result, you have a smooth skin palette in that area. That requires deeper resurfacing for sure in that region, and depending on how deep your lines are, you might have the opportunity to treat it 100% correction, or you might improve it by, say, 50 or 80%, depending on how deep. The deeper it is, the less opportunity you have to fully correct, because the wrinkle will go all the way down to the middle of the dermis, which if you try to chase it, you'll end up causing scarring and other problems associated with it. So deep lines around the mouth, one of the best treatments is resurfacing. I, again, love the Erbium YAG here, because even though you're going deeper, sometimes up to 700 microns and in some cases even deeper, what you're gonna do there is still allow the skin to heal within a reasonable time. And reasonable in this case means 2 weeks for the skin to actually heal, and then another 2 weeks for the redness, and sometimes even longer for the redness because you're going so deep. But at the end of the day, that's the ideal treatment, not to fill every one of those little lines over and over again, because you will inadvertently fill that area too much and look puffy around the lips. Number 5, you have a combination of dullness and the presence of reds or browns. Now this is where it gets interesting, because normal aging, you're gonna have a combo of those things happening. You're not gonna have one or the other in all these cases, you're gonna have a combination. So when you see a combination of dullness and reds and browns and all this kind of stuff, then what you're gonna wanna do is mix and match laser treatments. So you're an expert now. If I say, what do you think based on what we talked about you should use? You should say IPL for the browns, pulse dye for the reds, or BBL in the appropriate wavelength, and then resurface my skin with a micro peel or some type of superficial peeling laser. Now, that is absolutely correct, and that is gonna give you the best treatment, but at the end of the day, sometimes you don't have the downtime for it, sometimes you don't have the financial resources for it, but it's good for you to know what can treat what. Now, one of the lasers that has been designed to basically address these dual conditions is the Halo laser, once again from Sciton. Now Sciton, I keep mentioning it, but it really is one of the best laser companies out there, so their devices are incredibly reliable and good. So if you're fortunate enough to have a practitioner who uses it, know that you're using excellent laser in that particular case, but there are a lot of other great lasers out there. But the category where you're treating both these conditions at the same time, Sciton developed a laser called the Halo, and Halo has a fractionated resurfacing modality and a wavelength that addresses browns and even red spots. So you're going to get both of them treated at the same time with basically no downtime, other than some swelling and some redness and things like that. But you're not going to have to use the ointments and all that other stuff. So, but if you do the Halo, you're going to do them on multiple treatments. Again, 2 minimum, sometimes 3. Fraxels are also another laser that combines those type of ablative and non-ablative conditions. And I'm not very familiar with Fraxels. I've always been a Sciton user, so I know Halos really well, and is a very, very good treatment. But that's when you have the combination of those conditions, which is pretty common for more mature skin. All right, so let's change gears real quick and talk about what lasers don't treat. Guys, this is very important, so take very good note and memorize this. The problem with aging is that it looks like everything is coming from the same origin. The reality is, it's a mixed bag of conditions that are happening simultaneously. Aging causes changes in the skin, many of which we just mentioned, causes changes in volume, which is the loss of fat, which I talk about in a number of videos, and one we just recently published. And then you have laxity, which again we talk about a lot in these videos. But laxity, volume loss, and skin changes are the big 3. Those are the 3 things that are happening simultaneously. Now, I just pointed out that lasers have a place for treating these particular conditions. Nowhere in that discussion did I say that lasers can be used to treat sagging jawline or a sagging neck. And that's for a very good reason, because they don't work. They don't do anything to treat sagging at the jawline or the sagging of the neck or laxity along the brows, etc. So don't get caught into this, some marketing tangent that takes you down a road that you think this new laser is going to do something for the tightening of your soft tissues. It won't. Laxity is related to the deep fascia getting longer. Laxity requires surgery to correct. Just know this, be very, very clear about it. Some of the non-surgical treatments, which I'm not a big fan of, are things like thread lifts, treatments like radiofrequency microneedling and things like that. I'm not a fan of because they have their own set of complications and they also simply don't work, at least don't work in a more significant way. So laxity is not a condition that is treated by laser. So don't try doing like the latest and greatest and deepest laser you could possibly find to try to fix your sagging neck. You'll be very disappointed and you'll go through a very long recovery to even consider that. Another condition that lasers do not work well in is the treatment of melasma. So if you have melasma and you're thinking about how on earth am I going to treat this, melasma is an extremely complicated condition. It's born from a lot of different things, but sun is a massive component of exacerbating melasma. I'm going to probably do a video on that in the future. I'll talk to you about it, but just know that there are no lasers that will get rid of your melasma, and in fact, many lasers will exacerbate the melasma. So very, very important. Don't fall into the illusion that you're going to do a laser to treat your melasma. But that's enough for now, and later we'll talk a little bit more about that. So one of the most important things to know when you are thinking about getting a laser is how do you avoid complications? And what are the complications? Basically, the most common complications are things like burns and hyper or hypopigmentation. So the condition that gives you likelihood to get a burn is the reds and the brown spots, mostly the brown spots, where you end up getting an IPL. IPLs, if they're not done the right way, or if somebody doesn't read your skin the right way, and the power and energy that's deposited into the skin is too high, the skin is going to absorb a lot of heat, and as a result, it's going to blister, burn, and depending on how much of that effect happens, it could be a first, second, or third degree burn. So very, very important to understand that it's extremely, extremely important that when you have those particular types of lasers, especially, that you go to a very experienced, reputable laser technician, laser specialist, somebody who really understands lasers and has a lot of experience, and you're in good hands, because the user plays a big role in how that turns out and how you can mitigate that particular complication. Problem with burns are that it could lead to scarring, it could lead to discoloration, it could lead to hyper or hypopigmentation, and some conditions can be permanent. The next situation is when you have post-inflammatory hyperpigmentation, meaning that you get a laser done and your skin gets very red for a while, and then when the redness goes away, you're left with some brown spots. That's a condition called PIH, or post-inflammatory hyperpigmentation. Now, the good news is with post-inflammatory hyperpigmentation is that it's always temporary. It has treatment associated with it. You can use hydroquinone, you can use retinol, sometimes a little bit of steroid. Ultimately, these things will decrease the duration of the pigmentation, and it'll cause it to go away with very little consequence or very little aftermath. Now, how can you avoid it? Well, if you have olive tone to your skin, and we talk about Fitzpatrick scales, and Fitzpatrick is just a scale that clinicians use to judge whether the person is at risk of hyperpigmentation or hypopigmentation after a laser or a chemical peel. If you are olive tone, light olive tone, you're like a 3. If you're darker, you're 4, and if you're very dark, you have a 5, and beyond is 6. So the bottom line is you have to pre-treat when you get a laser, especially a resurfacing laser that is going to leave you with a lot of inflammation and redness, especially CO2, you got to pre-treat with hydroquinone for at least 4 to 6 and sometimes even 10 weeks if you have the opportunity to pre-treat longer ahead of time. Hydroquinone, 4% twice a day. You get that from your clinician. They'll write a prescription for you. You'll use it pre-laser, and as a result, you will really, really mitigate or decrease the potential for forming hyperpigmentation after laser. So much better outcome if you can nip it in the bud and go ahead. Like in our practice, we basically put everyone on hydroquinone when we're going to do one of our deeper resurfacing, just because at the end of the day, we want to avoid that complication from happening. Now, hypopigmentation is a bigger problem because hypopigmentation is permanent. It comes from the same origin, which is post-inflammatory, so your skin's red for a very long time, and as a result, it ends up decreasing the amount of pigmentation that the skin sees. So hypo, unfortunately, is permanent. So we see that a lot in people who have deep resurfacing around the lips. And again, the Sciton erbium YAG decreases the duration of redness associated with that, so we don't really see it with that particular. That's another reason why I really like the Sciton and why I like the erbium YAG laser. But the concept is CO2, for example, if it's being done deep, or a deep chemical peel, for example, you have a very high chance of having hypopigmentation. And the same condition can happen after a burn. So hypopigmentation can be avoided by not going too deep or not using lasers that are known to have that particular quality of causing prolonged redness and inflammation. Unfortunately, there's not a lot you can do to pre-treat, but you can post-treatment, if the redness is going on for a long time, use some topical steroids and things like that to calm the skin down and decrease the duration of redness. So those are the big three complications. Now, finally, the big secret. Guys, all of the lasers in the world, all the skin treatments in the world are amazing at treating specific problems like the ones I listed in the beginning of the video. However, they only work temporarily. And I know they're expensive, and I know you're going through a lot to go, to recover from them, etc. But you gotta remember, the skin is constantly aging. So obviously it makes sense if you use a laser and it does something for a period of time, that it's not gonna continue to stop the evolution of skin aging from that point forward. So what you're doing when you do a laser is effectively you're doing like a boot camp, like an exercise boot camp. You're bumping everything up, you're getting in really good shape, right? Analogy. But what is important is what you do after that boot camp. And ideally, you wanna be on a solid skincare regimen and excellent sun protection. That's your daily diet and exercise. That's the stuff that's gonna keep you from going backwards. And if you use a laser, if you're on the right treatments, and I'll talk about that real quick, the right active ingredients that you're using daily, then what's gonna end up happening is the laser is gonna jumpstart and move your skin up to a higher level, and then you're gonna maintain it with the skincare that you're using on a daily basis. And very, very importantly, the sun is so important to avoid as much as possible. So use your sunscreen and physical blockers if you need to, like hats and things like that if you're gonna be out in the sun for a long time, because the sun will bring all that brown pigment right back into the mix, okay? So that's very, very important. So what basically constitutes a good daily skincare regimen? You gotta be on a retinol, you gotta be on a vitamin C, you gotta be on niacinamide. Ideally, you wanna be on something that suppresses the melanocytes and decreases pigmentation. You wanna be on something that brings hydration to the skin and plumps up the lines and wrinkles. Those are the kind of foundational things. Unfortunately, those things end up requiring multiple steps, and that was a big reason why, in my practice of trying to get people on these treatments for a long time, failed to keep them on it for a long time, and I basically developed the Karam MD trifecta, which basically treats all those conditions in 3 basic steps: cleanser, vitamin C, and this all-in-one anti-aging. The 3 of those things is basically all you need to do to improve your skin on a regular basis and get it to the next level after a laser type treatment. The trifecta has also been clinically tested, so I'm not just saying this out of the fact that I made it. It is actually effective and proven to actually do the things that I'm mentioning here. So very, very important, guys. Diet, exercise, that's your daily skincare routine, and sun protection. Then go jump in and get a boot camp to treat specific problems with the indications that I just mentioned. Number 1 way for you to address skin. All right, everyone, I hope this helped. Gives you a little bit more clarity and a little bit more guidance as you decide what treatments you want to have done. If you have any questions whatsoever, drop them in the comments below. I always do my best to get as many of them answered as I possibly can. And if you haven't already, make sure you subscribe to the channel so you can get more content like this. We drop about 2 to 3 videos every single week on topics related to facial rejuvenation and skincare and education. And make sure you share this and pass this along with some friends who would benefit from this knowledge as well. Let's get the knowledge out there, because knowledge is power. And ultimately, if you liked it, hit like, and look forward to giving you more information and hearing from you. Thanks so much, Dr. Amir Karam.